Hello and welcome to the Catching Up with Kate podcast, episode 41. I'm not going to do the thing I always do, which is second guess myself. Hello, yes. As you may see, we've had some work done. Um, Fortunately, nothing up here, so got excited. Nothing like that. Damn it. Okay, so today's episode is going to be centered around my experience with birth control, or like my rod thingamabob. It does feel a bit weird to talk about, kind of, but it's also one of those things where it's like, well, why? Why should it be weird? Does it need to be? Also, it's one of those things where I would rather talk about it and be honest and like maybe help inform someone else about the thing, because I feel like there's a lot of people who talk about this, and I get videos every so often about people and their own experiences, and that's great, but the majority of what I see is negative. Okay? And also, another thing is that, like, when it comes to getting stuff like this done, for me personally, I find it very useful, or like very comforting when I can watch someone, or if I can hear someone talk about like their experiences and they're like a real person and stuff. And I don't know, it's just like nice, right? And I think a lot of people maybe don't want to put this stuff out on the internet, but I'm kind of like, whatever, doesn't matter to me anymore. Doesn't matter to me anymore, it's too late for me, guys. Yeah, so I think we're gonna go through I guess the beginning. It's gonna be like one of those movies. You start a little bit at the end and then you come back to where it all began. So it was a cold wintry day in June when I was born. No, we're not gonna go that far. We're not gonna go that far just yet. But anyway, I wanna do make some acknowledgements here for a second. Um Guys, I'm not a doctor, if you couldn't guess. I'm not a doctor, I'm not a medical professional in any capacity. This video is purely my anecdotal experience and meant for entertainment purposes, although I don't know who's entertained by all this. You're gonna get to there. We're gonna get to a point where we're watching this and we're like, is this entertaining, or is this more like toe gripping realness? I don't know. But yeah, so if you are experiencing a, a a medical emergency at any point, I cannot help you. Um, go get help. Literally. Um, what else do I need to say? Yeah, just bottom line. Not medical advice. Not whatsoever. Okay? Cool. Glad we got that sorted out. Alright, so let's head back to the very first time I got this Implanon thing put in me. I believe it was. Let's see, I first had it replaced 2022, so 2019. So I got it put in 2019. So let's type this in. What's the time for this? Okay. So I'm doing my timestamps. First implant. Okay. I got it put in 2019 summer. Summer in Australia, that is. And it was like all well and good. I think how it worked at that point is I went and saw the doctor and I said, "Hey, I want to get on this thing." And she kind of explained to me like, "Oh, well, here's the risks, here's the benefits, yada yada yada." One thing in particular that she mentioned is that women will the type of bleeding, menstrual bleeding you get while on it can vary a ton. It can vary so much depending on like just who you are. It's like everyone's bodies really react very differently. And so They kind of say like some women get like the short end of the stick where they bleed like constantly for like a month or months, plural. And then some women get like a nice end of the bargain where you don't bleed at all. And that sounds really nice, doesn't it? I don't remember the statistics for like who gets what or how good of a chance it is that you get one of those. I do know for me personally, um, I don't really. Yeah, okay. Now I'm starting to see where I was kind of like whatever, whatever. I feel like menstrual cycles shouldn't be like a weirdly demonized thing. So I'm just gonna say I don't actually experience it like ever, to be honest. If I do, it'll be like spotting here and there. Yeah. So that's like a kind of like a part of it where probably one of the reasons I've stayed on it for so long. One of the core reasons, I guess. And I I've had a pretty good time with it. I will say I do think as the years go by, because you're supposed to only have it in your arm for 3 years and then it needs to be replaced. I know some places it's like 2 years, which is like 2 years. Girl, that's like 2 years too short. Well, it's 1 year too short for me. I like the 3 year period because it's like it's enough time to get accustomed with the one you got. It feels like a lifetime, honestly. I really the last time I had it replaced was like so long ago. Anyway, so you can experience like some interesting menstrual patterns, which is like everyone's different with that kind of stuff. Some people care, some people don't. Um, I know some people who have like a really bad time on it, and that really sucks. So I would just say, as your big sister advice, yeah, I'm still young, okay. I would say that if you do experience like weird menstrual cycles on it, then just go see your doctor again and like just kind of talk to them about it. They do recommend, from memory, you just stay on it for at least 3 months. And if 3 months go by, I think, or 3 or 6 months or something go by, and it's like still not like leveled out, that's when they go, okay, come back and see us, okay? So there's that option for you. But yeah, like I was saying, I do feel like I've noticed that like things get a bit weirder near the end of the rod's life cycle. I think. I don't know, but then again, so much of it could just be like psychological, you know. Like I remember before I was on birth control, I would have like I would miss my period a lot because I'd be super fucking stressed. Or it would come like super fucking early, or I'd have it twice in a month, very very rarely, because I was just that stressed. And so we got to remember that stress is really like it does so much. It really does like a number on the body. And the menstrual cycle is just one of those things that really make you go, whoa, this shit's fucked, man. So yeah, so the first implant, I got a prescription. You have to get a prescription and go to a pharmacy to buy the applicator that the doctor will use. That way it's like sanitary. Um, I don't know what else to say. It's like sanitary, and also today, or not today, but when I bought it, it cost me like $30, $31. So it's not very cheap. It's not very cheap at all. But it is for like 3 years worth of protection. An added layer of protection, I should say. So so yeah, just like keep in mind that like yeah, $30, it is a lot of money for it, but it's over the course of like 3 years. So I feel like that's to me that's worth it. Anyway. Um right, what else was I thinking? So when it comes down to it, my first time getting it, I had to go the next day. Lately, what I've been able to do, the past two replacements, I've been able to go to the doctor and get it replaced same day. Wait, now I'm thinking about it. Yeah, yeah. I think it's just because like the clinics are different and I have a clinic that has like it's like an all-in-one special. So whereas the last one, it was like the clinic and the pharmacy were like so far away from each other. It was like, ugh. So yeah. Anyway, oh yeah, and yeah, but I think a doctor's office will have like a treatment room. So what they do once you get the prescription and you go to the doctor, whether it's a different day or the same day, um, they'll take you to a treatment room where you'll probably have to lie down on your back, and they make you put your arm up kind of like this or like kind of like that. If you've never had one in, they don't need to feel for a previous one, obviously. We can talk about replacement later. But yeah, if you're getting it first put in, they kind of just like you're lying down, you put your arm like this. They they numb the area where they want to put the thing, and usually they'll like use a marker and mark down like where they want the um insertion to go, and then they'll mark down like where the end should be or something. I have no idea exactly how the insertion process really works. Um I've looked at a diagram before, but I don't completely understand what is happening there, but there's actually some interesting history behind that. So, Implanon has actually been around for like a very long time, since like the 90s, I think. It's been around for a while. And one of the cool things about it that we in our current generation get to benefit from is the fact that this technology has been around for so long, and they've actually gone through a couple of different applicator plans, or what's it called? The applicator for the Implanon has actually changed over time. It used to be a two-handed insertion method. I think so far I've seen my doctors all use two hands, but it's like a insertion tool now that's meant for one-handed insertion. And the reason why they changed that, I believe, is because it makes it a lot easier for doctors to insert it into your arm. And it's basically just like supposed to be much better for the patient and insertion process. So I thought that was really interesting. I've read up a lot of stuff about this shit because I did get into kind of like a anxiety spiral before my reinsert. So I went through like all the research. Dude, there's like a shocking amount of like little research though. I will say that there is like, well, free ones anyway, ones that you can read for free. But yeah, I read up on like all sorts of things. I read up on migration. Yeah, that's a fun part of the implant. That's a fun possibility, I should say. And it's one that a lot of people probably heard about. So I guess we actually go into that right now. So chances are, if you're a woman or if you're interested in this kind of stuff, you've probably heard of the horror story. There's like two real big horror stories that newspapers always, or like tabloids always focus on, and there's two cases where one woman had open heart surgery to get her implant removed, and one had a a lung surgery because it was stuck to like a part of the wall of her lung. Okay, so those all sound really fucking scary, right? I know it scares the shit out of me. Definitely, it would scare anyone. I would like to say though, these cases where this has happened, very, very rare. But also, these people who had these surgeries, they had fine outcomes. Their surgeries was successful, and they were out of the hospital after like a couple days. Like they were okay. So I just want to say that they were okay. They're still okay, I believe. Um, Now migration is like a really interesting part of all this because it's very scary. It's also kind of rare, but I will admit that a part of like all the research did admit that cases of migration don't have to be reported. They don't have to be yeah, reported in any circumstance. It's only a voluntary thing if the I guess if the doctor feels like it or if the patient feels like it. I don't know. I feel like, to be honest, if that shit happened to me, I'd want to report it because that shit would piss me off. So I don't know. It's like I can't imagine many women having that experience and being like, "Oh well, I'm just not going to say anything about it," right? And I feel like if it was happening a lot more often, we'd be hearing about it a lot more on like social media. People coming out and talking about it. That's what I think anyway. That's my theory. Um, I've never known anyone to have it happen to them. That being said, I don't know a lot of people, so I don't know. But yeah, okay. So migration can occur, I think, because there's a part of the arm where if you put it too close to the sulcus, I think it's called, it's like a very vascular region where the rod could migrate. And I think, let me point to where I think that is. I really don't know if I'm getting this right, but let me point to where I think it is. I think like, yeah, like maybe like, no, I think it's like over here or something. I think it's over there or something. I'm not entirely sure. And then there's another region where you don't want to put it, which is like, oh, don't look at him. Don't look at him. Hold on. Ah. Sorry. Well, now the cat's out of the bag. This is my new husband. Yeah. This is my new husband. He's got a carrot for a nose. If you know, you know. I'm very happy with him. Okay, so there's another part of it where you don't want it to go, which is the very like bottom area, so it's like the underside of your arm area pretty much. That's what I think anyway, judging from the diagrams I saw. Um if you get it down the bottom of your arm like that, I think there's risk for like nerve damage or something. I could have this totally backwards, I'm not sure. But I think that's like, and it's also a very vascular area, maybe. I'm not sure. I don't totally remember because this was like a week ago that I was researching this. Was it a week ago? It's like, yeah, it was like a week ago. Wow. So yeah, anyway, what I'm really happy about with this reinsertion is that my doctor was very meticulous about the placement. She measured it out. Um, the previous site that it was put in was good placement, but it was in too deep. Okay? It was in too deep. So here's something else I want to talk about with you guys. Now, I want you guys to take away from here to be being able to advocate for yourself. And when it comes to advocating for yourself in a doctor setting, it's like, well, I don't know what I need to advocate for. So how do I advocate for something I don't know I need to do? Well, this is coming from me, from my lived experience. You heard it here first. Um, if your doctor inserts the implant too deep into your arm, I think I think that is like another case where migration can happen, but there's like a few other things about that I'll touch on after. No, if you get inserted too deep, what happens is if it's time for removal or replacement and the doctor can't find it, then you get the fun experience of what I went through. Now, when I was in the doctor's office, just even like asking like, "Hey, can we do this today?" She made me lie down on the bed and put my arm like this because she couldn't feel it. And so she was like really palpating like the entire area trying to feel for it. And I was like, I mean it's like right there. But the problem for her was that she just like she couldn't really feel it like at all. And at some point she was like, yeah, it's in like really deep. And she was like, there's a chance that we might not even be able to get it out today. There's a chance that like um yeah, like that I'd need an ultrasound. So like another cool thing about this technology is that the implant has it contains something that makes it noticeable on like x-rays and ultrasounds. I don't remember what it is, but I'm sure it's totally safe. But yeah, there's like a thing that so it will show up. Did you know that like it used to not be like that? It used to be like the case where if it went missing, it's like don't know where it is. Don't know where it is. Could be anywhere. See ya. Isn't that crazy? I think that okay, I think that's I don't think that's misinformation. Yeah, so I think at some point they started going like, wow, we need to make this thing like traceable on X-ray and shit. Damn. So yeah, I had a deep insert. I'm gonna say the first time I had it reinserted, the replacement, I chose like an older doctor, I guess. As a female. I always go with female doctors for these kind of things. And look, I I have a hard time like blaming doctors for things or being like too upset with them because I know doctors go through like a shit ton of stuff, right? But when I look back on it, the procedure was like super informal in a way. Yeah. Yeah, I think looking back on it now, it's like I it's, I feel a little bit like it just wasn't standard practice, if you will. And yeah, I think like the first round of numbing agent that they put on my arm wasn't enough, and I've come to realize that I need like twice the amount of numbing and sedative than like what's the standard, I guess. I'm so special. And I think she put in the first round of sedative or not sedative, fucking numbing agent or whatever. And I think she was about to do something, and then I was like, no, 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 I feel that, I feel that, I feel that. And she was like, you feel that? Like, what? And then she's like, oh, I guess we gotta put on like more or something. This was a while ago, granted, so my memory might not be the greatest, but I think I remember being like, no, 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 I feel something. I think. Anyway, so what ended up happening is she just like inserted the thing. It was a very quick removal and insertion process last time because the very first doctor who put it in actually like fuck, it was uh like around there or something. And she put it in really shallowly in the skin, which is great. Love that. I think the initial placement of it, I don't think the placement where it was good, but the shallowness of it, very good. I love a shallow implant. So, last doctor had a great time getting it out. Super fucking easy. Nice. Glad that you had an easy time. I'm glad that it was good. Because this time wasn't fucking good. This time fucking sucked. So, this second doctor who's doing the first replacement, she just like she inserts it. It felt like she put like so much force into it. It's like the insertion is such a weird process. I don't really understand it, but um yeah, and then like after it was done, she was kind of just like, okay, it's done. Here's what you need to do for self aftercare, blah blah blah. But what's normal is that once they put it in, they're supposed to get you to like feel for where it is, like palpate it yourself. So like there's like they give you like a little card in the packaging where you write down like which arm is it in, did the patient palpate it at the site, did the doctor feel the palpation at the site, was it actually put in, because they've actually had some cases where it was not put in, like they thought it was in and then it wasn't. Really like bizarro stuff, I guess. um so it's really important that you get that at like the end of the insertion where you get to feel where it is and be like, okay, that's where it is, and that it's actually there, and that your doctor is actually like, here it is, hey, look at this, huh, that's crazy. That's really important, and that did not happen that time. That time my doctor just kind of like was like, yeah, it's in, cool, okay, see ya. Yeah. Yeah, that was I think at the moment I did feel like, wow, this is like so not like procedure. I felt like this doesn't feel like procedure, like this feels very like flippant, because on the card that they give you, it's also supposed to have your full name on it. She didn't even write my name correctly. My name wasn't even spelled correctly, which I know is like, it's like, okay, well, it's probably like a detail that no one gives a fuck about, but it's one of those things where attention to details, like she even had a nurse there with her helping her. It's like, that attention to detail I feel like is so important, or I feel like it kind of says a little bit about the people that you're dealing with in a way. Sorry, that's what I think. Um, yeah, so it was like not the greatest, and there were even a lot of times over the course of those 3 years with that last implant where I would feel for it, and then I'd be like, "Oh, I can't feel it. Oh my god, it's migrated," and then I'd be like, "Oh wait, it's right there," but it was always like really hard to feel for at first. So there were like a couple of scares with that last one, but anyway, I digress. So how do you advocate for yourself? I'm just gonna say, if you go to a doctor and you ask for this procedure to get done, be like, can you ensure that this will be placed in my arm shallowly and not deeply? Can you ensure that the insertion is shallow? Because you do not want to go through what I went through last week. And so here we go, a smooth transition to last week's insertion. I think I'm doing this all right. I think I'm doing this okay. Um, okay, what is this called? Second replacement. Second replacement. Okay, so it's last Wednesday. I've been very nervous coming up to this because it's always kind of nerve wracking because they have to make an incision to open up, like just a really tiny incision, to open up the area to remove, like pull this thing out, and then they have to reinsert. Um, I think anyone would be a bit like nerve wracked about that. Okay, so very normal feelings, a little bit nervous, but then I was like, you know what? There's always a possibility that I don't know, it'll be fine. It'll be good. And I was like, really just like, yeah, it'll be fine. And so I go in, and then the moment that, yada yada yada, long queue, we go into the office, and I tell her about wanting to get my, replacement done that day, and that it was the day of. So there's like a thing about the insertion process initially. Um, listen to this, ladies. If you want to get it inserted, you have to make sure you're like half, like for the very first initial insertion, it has to be like halfway through your menstrual cycle or something. Like look it up, but you do have to be on a particular day of your cycle or something. And another thing about that, I mean, you don't necessarily have to do it. I think one of my friends didn't even, they just chose a day and they just did it. But that has something to do with like when you're actually protected by the implant. Oh my god, by the way, I guess I didn't mention it, but like something cool about the implant is that it's my doctor said it was a 99.99% effectiveness rate for you know, unplanned pregnancy prevention or whatever the fuck. Um she said like, oh, well, we technically can't say 100%, but it's basically 100%. They just technically can't say it. So, I mean, there's that. Yeah, what else did they say about that? Oh, and my doctor this time around last week actually told me something really interesting, is that apparently if you're on the rod and you do get pregnant, they actually have to like file that, like they have to report that to like a bureau or something, because that is like such a catastrophic, she said by these words, it's like a catastrophic failure of the implant. That's like next level, like it should not, that should not happen. And even a lot of the research, hold on, I need a drink. Hold on, it's been like 30 minutes. And most of the research that I had read about like unplanned pregnancies, like I've never been worried about it on the thing. Like I trust this thing with my life, literally. Um, but a lot of things I read were cases where women were already pregnant before they got it in. Then there was like a thing that happened. Oh shit, what else was there? I think it's mainly they were pregnant beforehand, or the doctor who was inserting it actually never inserted it. Like it never went through. That's why it's so important to palpate it at the site. Okay, girls? Okay. Um, So we have my second replacement. Yeah, so we're in the office, she's telling me about all this stuff, yada yada yada. She's like, it's great that you're getting it replaced the day of, like exactly. Because the fertility actually returns really quickly afterwards. So the way I always thought it worked is that I thought that they just told you like, oh, 3 years, but I didn't understand that it like stops working like dead on pretty much after 3 years. That's insane to me. Like I thought, whoa. I don't know why, but I just thought that I think I read somewhere. I think it was with a different implant. That's what it was, where they had a recommended time, and then after that time, the results would be like very like, "Oh, we can't guarantee nothing." Kind of sounds a lot like it just stopped working to me. That was quite a few years ago I read that, so maybe things change. No, I don't think so. Anyway, so yeah, so it's really important that you get it replaced on the day that the card that they give you says. If you don't get it replaced on the day, I think what ends up happening is you'll need to you won't be fully protected until like after a week. So to me, I'm always like, let's get it done on the day, you know? Let's get it done on the day. So, um yeah, and like that's another thing. The card that they give you, like I keep it in my wallet because I mean, you never know, like in case of emergency, if you're like dying on the side of the road, maybe the EMTs need to like check your wallet. Does she have anything? Does she have any money? Does she have any credit cards? Oh, what's this? Oh, Implanon thing. Oh, she has it in her right arm. Okay, we know this now. Oh, $10. Yoink. I'm joking. I'm joking. I love the EMTs, okay? I'm kidding y'all out there. I don't know why I sound like that. Okay, so anyway, I like to keep the card. I like it. I was actually really excited to get a new card because I wanted it to be nicer than my old one. My old one was so ugh. She just put in the insertion date and the removal date and then misspelled my name completely. This one, they spelled my name correctly. They put in the oh, I will say with my new card, the insertion date and removal date, the year, which is like the most important part of it, um, her 5 and her 8 really weirdly drawn. So I guess I'd give that one like a 6 out of 10. I guess. All right. Anyway, back to the like normal stuff. So we're in the clinic and she's feeling around my arm. At first, it's like really hard to find. After like 10 minutes of like looking around, really like pushing her fingers all over my arm. Mind you, whenever I get these put in, I get very like skittish about touching the area like at all. I get very skittish about it. And I remember the first time I had it replaced, they were moving my arm around so much. I was like squeaming because I was like squeamish because it was like, I didn't think you could do this. I thought this was like not okay to do. But I feel like when you're in that setting where it's getting taken out, it's like it's fine. It's getting taken out, just move it around, whatever. So that's another piece of what I think that I'm given to you. It's okay if they're feeling around a lot for it when you're getting replaced. It's fine. It's okay. They need to do that. Um yeah, then I went and got the prescription, then I waited outside the treatment room, and then they went, "Hey, it's your turn." And then I go in. I go in this little room. Actually has a lot of privacy, which is nice. Um the last time I had it replaced, I was in like the treatment room like where they put all the beds together, I guess. So it wasn't private really like at all. I don't really care about that because there was like no one else there. And they have like curtains and shit. But it felt very casual. I was like, oh, this is so casual. You're just cutting into me on a random like Tuesday, Wednesday. It's so weird. So this time I was in a room and my doctor did warn me. She was like, "Hey, you know, if it ends up that I can't get this out, I will have to get another doctor to come and do it for me." And her saying that kind of made me go like, "Okay." But I also liked how like she was like, "This is happening today. We're doing this." I like the dedication. I really do. Um, Yeah, because it was one of those things where it's like they could feel it, they just couldn't see it when they were going through my arm, and that was like a big problem. Mm, yeah, oh god, I feel like I just remembered something I needed to say. I'll remember it anyway. Um, so yeah, so I'm sitting in the treatment room. They do numb the area. It's a bit of like a scratch. It's a little bit of like a sting for like a second or something, but it's really not that bad. And I don't have a bad time with needles at all anyway. Like I'm fine, and I feel very lucky that I'm like not bothered by needles at all. So they had to do that a couple times and wait for it to kick in. That did take up quite a lot of the time actually, if I'm being honest. My I guess my body's just like super sensitive or whatever. So there was that. Um, what else was there? Yeah, so like when it came to the actual like removal process, it was terrible because my neck was so sore. I was like purposely looking away because I just didn't want to see it all what was happening because I could feel it. Like even though they numb your arm, you don't feel pain, but you still feel like sensations and stuff of like pulling and pushing. And in my particular case, they had to do so much pushing and pulling. It genuinely took like 40 minutes. Like and like at first the doctor was trying to do it by herself because they were kind of full in the office today, or like this day. And every so often she'd be like asking for a nurse to come and help, and she needed a nurse to literally like hold my arm and like push on my arm like it was like fucking Play-Doh or slime or something. And they had to use so much force in that. And and it was like constant like massage, like not even massaging. Oh, this wasn't a massage, man. This is worse. This was worse. This was like next level. This was not a massage. It wasn't even deep tissue. It was like deep tissue. It was bad. And so like there was so much pushing and pulling, and like I guess that's kind of the part that kind of hurt for me. Um yeah. And like looking back, I don't want to say like I feel like it is very dramatic to say like, oh, I was traumatized. I don't feel like I was traumatized in the the traditional sense. Like I feel like been I feel like I've processed what happened and stuff, and I feel like I was well cared for, and they definitely tried to make sure that I was okay and stuff. Um, and they were just doing what they had to do to do the job, I guess. I just think that like yeah, it would have been really nice to just not experience that. It would have been really really nice. And I was kind of thinking to myself afterwards like, man, I hope this is like the last time I have to do this. But then coming out of it, I was kind of like, you know what? I mean, it's not going to be, let's be honest. But I was like, you know what? At least now I know like what I really need to look out for. And at least next time it's going to be a super easy replacement process because this doctor, she said, I like to insert them shallowly. I don't like the deep insertions. So I was like, I really like what I'm hearing. This time around I chose like a younger doctor, female again, a younger one. At least she looked kind of young. Um yeah, she was very nice, she was very sweet, and yeah, I felt like at some points during like the process of trying to find where the implant even was, like when they'd made the incision, because they had to make the incision, and that's when they were looking around, mind you. I have like an open incision and they're like pushing and pulling and like squeezing my arm so much. Also, I'm not gonna lie, um, kind of made me feel a little bit insecure about my arm. The initial process when I was first on the bed and she was trying to figure out where it was in the first place. She's like I was like watching her squish my arm, and I was like, oh my god, my arm has so much fat. I was like, oh my god, why did I ever stop fucking lifting weights? Man, it's totally mean to think that about myself, but I did. I'll admit it. And that's also why I was looking away. I was like, I can't look at them squeeze my fucking sausage arm. Actually, to be honest, sausages are like skinty, so never mind. My flabby arms. But I love my arms because look at what they're doing for me now. Yay. Okay, so what else was it? So yeah, we get it like replaced. Um I really wish like I could put into better words like what I experienced. But I just can't. I really just can't say anything else about it, to be honest. And I feel like, yay, I did it. It's done. It's over. I don't have to do anything else for like 3 more years. Love that. But yeah, it really sucked. And I made sure I wrote a bunch in my diary about how I felt because I was like, there ain't no way I'm getting traumatized over this. Nuh-uh. So there's that. But again, I just want to say, like, this was just simply because my last doctor put it in way too deep. Now, I don't know how the hell you even make sure it's shallow or deep. I don't know how much effort goes into that. Um, the doctor this time around was very, like, slow and, um, as she was inserting it, it was very, she was very focused, I think, and she was actually saying, like, oh, the very first time I ever did one of these, I actually didn't put it in the whole way. And I like looked at her and she was like, "This isn't my first time though." And it was a really funny moment actually where we all kind of laughed with each other, like me and the nurse and stuff. And she was like, "Oh yeah, I'm just like super paranoid about not putting it in all correctly." So she's like very careful when she does do it. And I just thought like, yeah, wow, that's actually I appreciate that. Like I actually appreciate being told that. I appreciate hearing about that. I think it's so interesting. Um Yeah, so like, oh, you know what? Another thing that happened that I was talking to my friend about, my best friend about, when we were in the office and when I first saw her, I know I keep jumping back and forth here. I'm so sorry, but when we were in her office, she actually had to look up on Google like the insertion area, I think, and I actually really liked seeing that, and here's why. I think that for a doctor, like a doctor, guys. We're talking about a doctor here, a GP or whatever. These people go through so much schooling. They go through so much training, so much they have to absorb so much knowledge. Like I don't expect them to memorize every single thing that like they have to do. And they probably have to do a lot of different things during the day. Like I kind of sort of sat there in disbelief, like, damn, it's just a regular ass Wednesday, and here she is doing incisions, inserting shit, doing steri strips and dressing and stuff. And then like her next patient could just be like the flu or something. God forbid, actually. Not the flu, but like just general cold. And then her next patient was, oh yeah, one of her patients was doing a blood infusion or something, an iron infusion. It's like the amount of different things that doctors have to do in a given day, let alone a week. I thought it was actually really good because I had done a lot of research before this about the insertion site and like optimal areas and stuff. And so when I saw her looking it up, because I noticed there was some advice that had changed on the official Implanon website. They had some changed advice of like where to put it. This is good. Doctors who keep up with like what's happening, when they keep up with like what the current methods are, that's good. That's what you want your doctors to be like. You don't want your doctors to be all flippant and like, yeah, I can do it. Been doing it for 20 years, I can do it. No problem. You know what I mean? There's like a humbleness to it where it's like, okay, I'm gonna look this up because I need a refresher. Or I just need to know if anything's changed since I last did it. Like I actually really like that part of it. So um it's like the same as if you're getting like your arm put into a cast or something. Like if your doctor was putting a cast on you. No, I think I saw a TikTok ages ago where it was like, "Yo, my doctor's looking up how to bandage a sprained arm or something, or a sprained ankle. Am I cooked for real? For real?" And it was like, no, like they know how to do the things. They just need a video refreshing them on like one thing or another, I guess. Am I coping? I don't think it's cope. I think it's actually really good. I think it's healthy, a healthy mindset to have. And like, yeah, sure, anyone can watch a YouTube video about like wrapping an ankle or something, but the doctors or the nurse probably gonna do it a lot better than what anyone else could do. Anyway, it's kind of like different things, whatever. So I'm just gonna say, yeah, I if my doctor looks up something in front of me, in fact, they do it all the time actually. Yeah, like when I first saw the doctor for my TMJ issues, which I still have, by the way. Um, nothing changed there. I think they also looked up some stuff on the internet too. I think that was more for me though, to be like, here's your face, here's where it's fucked, and this is why it will always be fucked. Yay. Yeah. So, hmm. I guess that's it. One thing I will say about the replacement, the first replacement I had years ago, I felt woozy afterwards. Like I felt like actually like I was gonna kind of faint, if you will, afterwards. And I think there was like some suspicion, like, oh, maybe it's just like a reaction to the numbing or something. What I now believe happened, because I'm gonna be honest, I did consult with Dr. GPT, Dr. GPT, just a little bit before this um replacement, and Dr. GPT did say that you should make sure you have at least a small, like, light breakfast beforehand, and that you should keep your fluids up, but not like, I think, an hour before, so you don't have to go to the toilet while you're getting your shit done. Anyway, so I actually really followed that advice. I had a light breakfast the morning of my procedure last week, and I had I think I had protein yogurt and fruit. Yes, I had some protein and some yogurt. Yeah, and fruit. And then I made sure I drank like I think I had like a liter of water before going, but was it a liter? I don't know. Honestly, you could probably get away with like a hydrolyte or something. Maybe that'd be better. But anyway, I didn't feel woozy after this time. I actually felt fine. So that's actually really nice. Really nice. Yeah, so a light breakfast and keeping up your fluids beforehand. Really good. I would recommend, I guess. I would recommend, yeah. Because last time I felt so woozy, they had to take my blood pressure, and I had to just sit there in a chair for like 20 minutes or 30 minutes. And then it was so interesting. While I was waiting there, um, this woman shows up in a wheelchair, and apparently she'd been bitten by a redback spider. Oh my god. Now, I don't know if the wheelchair had anything to do with the spider bite. For some, you know what, looking back now, for some reason I feel like in the moment I thought like, oh, if you get bitten by a poisonous spider like a redback, don't look it up if you don't know. Save yourself some trouble, don't look it up. It's just a really poisonous spider, you know, like whatever. I thought like, oh yeah, maybe you just don't want to move around too much if you got bitten by a poisonous spider. But now I'm thinking maybe she was just disabled. I don't know. Maybe we should look that up actually. Um if you get bitten by a poisonous, I don't think that's how you spell poisonous. I've been having trouble spelling lately. I don't know what's up with that. Poisonous? That's not how you spell. If you get bitten by a poisonous, how do you spell poisonous? Okay, now I'm gonna look up something different. How to spell poisonous? Poisonous. Wait, I was spelling it correctly. Whoa, the way you spell poisonous is really fucking weird. Poison and then just O-U-S. Poisonous. Poisonous. Okay, I can't be bothered looking this up. Okay, I'm looking it up. Alright, I'm gonna copy and paste poisonous. Okay, if you get... This is so lame. If you get bitten by a poisonous spider, should you remain... I feel like that's like movie logic, don't you know? Should you remain still? Maybe that's a better way of saying it. Oh, sorry, readjusting. Alright, nothing here is helping me. It's all just like, what do you do when you get bitten? Reddit. Did she move again? Sorry, it's been a bit of a fucking disaster today. My new boyfriend just dropped. I can't look up what happens when you get bitten by a poisonous spider. I'm sorry for the disaster today, guys. Okay, whatever. I guess we'll never know. I guess we'll never know. She must have just been disabled. I don't know why that's like such a revelation for me, but it kind of is. I think it is movie logic, you know? It's like the faster you move or something, the more like the venom will like go through your bloodstream or something. I think that is movie logic now that I think about it. Wow. Yeah. Okay, so is there anything else I wanted to say? I think like yeah, in general like I'm pretty happy with this. I haven't noticed oh wait. A lot of women worry about like the weight and stuff on this. This was actually like the very first time I got it inserted, I asked that with my doctor. And she said that you might notice like a half a kilo difference. That's like baseline what it would add or something. But then she was saying, but you know, you might find your cravings are a little bit more like frequent, more intense. Again, it really depends on like who you are. Hold on. Let's go. Let's put in a timestamp. I haven't been doing my timestamps. I always forget midway through. Wait. Yeah, it depends on who you are. My personal experience, I think my weight has stayed pretty much the same. It's pretty stable actually. I will say like cravings and stuff. I've been on this for quite a few years, so it can be a little bit hard to say based on memory, but I think yeah, cravings are like present a lot more. Um, I don't think they're necessarily easier or harder to deal with. I think how you deal with them is kind of based on you, based on how you just deal with these things in general. Um, I'm always trying to look for better ways to be like healthier and to eat better food. And you know, like I actually really enjoy eating like fruit and stuff. I really enjoy having like a healthier diet. I do indulge in my cravings probably. I wonder if it is more than like it used to be. I think it definitely is more than it used to be. Because before I was on this stuff, it was kind of like mega cravings like around your period. This time it's kind of like whenever, most of the time, you just have cravings. But I've found like good alternative snacks to have that are like healthy that also kind of make you go like, ooh. So, I don't know. I'm dealing with it. I haven't noticed an insane amount of weight gain, but I do have I don't know, I have a workout regime that I really like. That's a really important thing. I like working out and I like what I do. So that means I do it frequently. Um yeah, and in terms of like diet and stuff, it's just like any kind of self I just said it and I've already forgotten what I was saying. Discipline. It's like any kind of discipline. It's not like it gives you like it doesn't give me like ungodly cravings where I'm like, I need this. You know, it's like I don't feel like I'm pregnant or anything. So yeah, I think like it depends on who you are, and I feel like it's one of those things where if you're aware of it, if you know that it's like a part of it, then you'll probably be better prepared to deal with it. I don't know. That's just what I think. But I'm also not that worried about it. But she did say that like the unavoidable gain that you get is like half a kilo. It's like nothing. So yeah. Um. What else? What else? So there's the weight gain aspect of it. I don't know about any other questions I had. I think that in terms of like, sorry, phone going off. I think in terms of like safety and stuff, I feel like it's pretty safe. I know that like other methods of birth control have a lot of they also have a lot of headlines about like certain problems like I think the pill people worried about it giving you like blood clots. I think even this one there's a hey, if you start getting these symptoms, you are a bit more at risk of getting like blood clots and stuff. I think. I really don't know. Never had any issues with any of that stuff, and again, if you know the warning signs for these things, that can be really important. Oh, one other thing I forgot to mention about migration aspect. Okay. I read a sort of research thing. This same research thing did state like, oh, you know, we only have so many cases to go off of migration just because like it's probably underreported. It probably is just because on the basis that it's voluntary. Um, so in saying that, they do hypothesize based on the um cases that we've seen is that the time where it does migrate between getting it uh, treated, that might matter a lot. So the reason why, like for example, that woman who had it in her lung wall, the reason why hers was so bad, I think, is because it had been sitting there for like months. Like she had no idea that it had migrated until she went to like feel for it, I guess, months later or something. And so yeah, that's because like if you think about it, a foreign body sitting somewhere in your organ, your body is going to react to it in a way where it like maybe it got, I think it got encapsulated or it got like embedded in a way. And because of that sheer amount of time that had passed, it became so like embedded that surgical removal was really really tough. Yeah. So I would say that just frequently making sure it's still there is very important. Now, how frequently you should be doing it, I'd probably say at minimum once a month. Check to see if it's there. Again, not medical advice. There is like a thing where like if you get it freshly implanted, don't really like okay, hold on. I'm getting ahead of myself. So yeah, check it at minimum once a month, I think. If you're really anxious about it, you could check it like twice a month. But once a month is probably a safe average. You know, it's like you're meant to check your breast cancer once a month. So just do it then. Start of every month, just check. It really only takes like a minute. Checking for breast cancer takes way longer. Well, I guess it depends on your size, but anyway, yeah, so another thing that I was going to say oh yeah, okay. So when you get it reinserted or just inserted in general, I'm so sorry for the background noise. You want to make sure that you do not do any heavy lifting for like I want to say like a week, a full 7 days, I think, maybe. I think the doctors recommend like 5 days. Like the doctor's like, oh, just like 5 days or something. I would go a full week. I would be really careful about it. Just, ooh. excuse me. Just because it's like, what can happen if like you touch it too much, or if you do like really vigorous exercise, is that can potentially lead to migration. Okay? So that's why I take it very seriously. No heavy lifting, no nothing. Also, when you have an incision there and it's just being held together by steri strips, just take a week off, you know? Just take a week off. It's no harm done. The laundry will get done. The dishes will get done. It's fine. Take a week off. You don't want to risk this like, migration shit happening. Yeah. So there is that. I've been really fortunate in that I don't have to do much heavy lifting. Caleb's taken over my dish duties and stuff, so I haven't had to risk anything with this. And man, it's like still sore. It's been sick. It's been 5 days. Has been wait Wednesday, Thursday, Friday. It's been 6 days. Oh yeah, it's been 6 days. So I reckon today this thing might come off. I might be taking this thing off for the island. It's called like an island patch or something. I think I need to take this off. After it's been inserted, they do put a pressure bandage around your arm that you're supposed to keep on for 24 hours. That's to help reduce swelling and reduce bleeding, I think. Yeah, I actually really liked having that thing on. It felt very comforting. I didn't want to take it off, honestly, but I took it off as directed by my doctor, and pretty sure this island bandage has to come off today. I kind of worried how gnarly it's gonna look. Though, like when I was seeing the doctor off, she was like, um, "Oh yeah, it's gonna be bruising," and then she was like, "After what we did today, it's probably gonna be really bruised." Okay, I look forward to seeing that. Um, I will say every single time I've gone, I feel like the doctor or the nurse, like they're always very vague about what you're supposed to do after. Very confusing. Very confusing. So, I like the nurse gave me extra wipes and island bandages or island dressing. Yeah, I think it's called island dressing. That's what it says on the label. She gave me extras, and I'm like, am I supposed to do something with this? I think it's like in a case where if it accidentally falls off, um, and then they just said like, oh, the steri strips they just stay on until they fall off. Okay, and then they're like, oh yeah, if it falls off like before then, or like before like a week or before 5 days or some shit, come back to us and we'll fix it. I'm like, okay. And then there was another thing where they're like, oh yeah, there's a real risk of getting an infection after this, so look out for that. Okay. So I could be getting an infection, I don't know. Um, is the pain improving? I guess so, a little bit. Yeah. It's still really hard, like I'm still feeling very cautious about it, to be honest, because it really does still hurt, like kind of a lot, I guess. And I don't know what happened, but I'm having so much pain, like my forearm for some reason. So I don't know if that's to do with like the computer because I was playing so much Project Zomboid over the weekend. So I don't know if it's to do with like the way my hand or my arm was sitting, or if it's to do with this thing, God forbid. Um, yeah, but I don't know. I guess that's kind of it. That's kind of like all the info I can give. I think we went through the weight. We went through migration. We went through my first implant. Went through my first replacement, second replacement. Yeah. I mean, okay, I guess there's like some other stuff like it can get bent. So if you have like a sport related injury, it can get bent a little bit. I think you need it taken out because I think the efficacy of it is not certain if it's bent. I think. I feel like I remember reading something about that, so I don't know. So yeah, if you do feel it bent, get it checked out probably because it's meant to be straight. Yeah, all right. I think that's everything. So yeah, if you're thinking of getting this done, if you're I hope I didn't scare anyone off. Look, if you do see a lot of people online talking about how they've had just the worst experience, just know that I'm having a pretty good experience. Like the only bad experience I've had is just the reinsertion, and that yeah, that's good. Mood swings. I mean, I don't really have like. Maybe I should ask Caleb this, but I don't think I really have mood swings. Um, I think I think in a way though to like reduce that, not drinking like alcohol probably helps because I think when I drink alcohol it can be a bit mood swingy for me. Um but I think these days like the older I am, the better I am with dealing with these feelings and I think I do sometimes get a bit mood swingy, but um it's like so embarrassing. It's like during the mood swing I'm like I don't be doing this. This is embarrassing. So I think I've been okay. Um Oh, something else really interesting I noticed is that as soon as I got this fucking thing put in, um, when I have a moment that makes me like really want to smile or something that makes me like really happy, I feel like I get like a surge of like happiness and like so that comes on so strongly that I tear up. And so I'll be looking at like someone's dog picture and I'll start tearing up and it'll be like I don't feel like tearing up, but this is just my body's reaction, okay? It's a really weird thing that I only started getting with this birth control. So I gotta say, interesting side effect. I am 1000% positive it is from this stupid fucking thing. It's really insane because like I will start tearing up and it's like so awkward because I might even be in a social setting with like regular ass people and we're in person and then I'll start tearing up and I'll start being like don't make eye contact because then they're gonna think that I'm fucking psycho. It's weird. So yeah, I think that's everything. Yeah. And look, like there's always alternatives. I know I keep yapping. There's always alternatives, guys. If this doesn't work out for you, don't feel too stressed about it. There's alternatives. Honestly, the best thing you can do is just see a doctor and ask them about stuff because they always say this. They always say, just come see us. Sometimes it's easier said than done, but that is at the end of the day what you should do in all these scenarios. All right? All right. So, I'm thinking to wrap up today's episode, um I was thinking of talking about the Baldoni case a little bit more. I was thinking about it and at the moment I think I'm waiting for more evidence to come out, more research, evidence, whatever. I'm waiting for the Blake Lively and Baldoni thing to go a bit further than what it has because at the moment both sides of the party, if you don't know, they're actually in the middle of suing each other. Can you imagine that? That's kind of crazy. And at the moment it is very much like she's saying a bunch of stuff happened and he's saying a bunch of stuff happened. Um she does have a lot of witnesses, or she does have quite a few people who are on her side who also, and other people who made complaints about Baldoni's behavior. I know, massive side note. And oh, but then a lot of people are saying like, oh well, she only has people on her side because she's rich and famous. I don't fucking get that argument. I really don't. I really don't get that fucking argument. Yeah, so I'm just gonna say, like, at the moment, I am very much against having like a one way opinion on these people in this case. It's interesting to me, but I think what I'm finding like very sickening is how quick people are to defend the guy in this circumstance. I don't know. A lot of people keep saying that she's very like Amber Heard vibes, which I think is like, let's not do that. Now, what I will say, is there a lot of evidence or a lot of footage of Lively as herself being a bitch? Yes, there is a lot of footage of her being a bitch. Absolutely. But to counter that, there's way too much footage of Mr. Baldoni being too poised. He's made his persona too much of like a male feminist. To the point where he has a podcast where he talks about being man enough. He has a TED talk about when will men start calling out other men. He's decided to make a film about domestic violence featuring him, the domestic abuser. Oh, it's just so hard making this movie about domestic violence, but I had to do it. It's like, I'm sorry. Someone who has made one political movement so much of their MO, so much of their brand, that gives me red fucking flags. I don't know about you. Like, let's not let those fucking pink blazers and low cut fucking hairy tops swayed us, you know? It's like, yeah, Blake Lively doesn't have that great of a public image, but the fallacy of being a perfect victim is extremely damaging to our society. Anyway, look, I've got to go. I've got to wrap this up. I keep yapping. But I am looking forward to talking about the Baldoni stuff more. But I just got to say, there's something about him that I just feel really off about. And I actually think in my last video I did say something about that. Anyway, we'll see what happens, I guess. Maybe I'm wrong. Again, I'm not on like anyone's side really. I think they're both kind of like got their ooh, stop. It's like every Blake Lively interview you're like, you can stop now. You can stop. All right. I'm going to go guys. I hope you enjoyed this episode for what it was. Ladies, if this helped you out, ladies, theys, thems, I hope it did, because that's what I wanted to do. So if this video can help reassure someone, I'm glad, because that's what I wanted. Alright. I'm gonna go now. Take care. I'll see you later, and take care of yourself. Alright. Goodbye.